The beauty of our program, I've always said, is has the secret sauce of clinical and academic medicine.
We have a really busy and robust surgical training program. We have a lot of dedicated faculty.
We have a very supportive model that's really not very hierarchical. And because of that, I think we have great relationships with the residents. The faculty really enjoy working with the residents, and the residents, I think, feel very comfortable asking questions and learning in a very safe and positive environment.
I think some of the strengths of the program with having a high surgical volume and training experiences in complex family planning and gender-affirming surgery, which are very unique training opportunities in San Francisco and things that they can't find in other places around the country.
Our subspecialties are GYN oncology, reproductive endocrinology, urogynecology, and maternal fetal medicine.
And they have access to not just amazing faculty, but also to the really large database of Kaiser Northern California patients. And so they're able to do projects with big data and answer really important questions that will push the field forward.
I think that we get to see like a pretty wide variety of like people from different backgrounds from around the city, and then also from like nearby smaller towns as well. But it always feels like a sense of community.
I think that this program offers a lot of opportunities early on, having very close oversight, and then from there, I'll slowly gain some independence on things. And I've never found myself in a place where I feel like I can't ask anyone any questions.
My goal as a program director is to train them to be critical thinkers, excellent surgeons, excellent clinicians, to really have a successful long-term career. And I think it's a program with a just culture, which makes it a great place to train.
Personally, I always say I wish I would have trained here, because you leave here with Kaiser Permanente sunglasses, which help you look at system-based practices better than any other institution.
And I think that this program just does a superb job of helping sort of the emotional, physical, mental challenges that OBGYN residents undergo in those 4 years.
Each year is a little bit different in terms of like the rotations that we do. You start off like right off the bat, like doing a C-section during your first month of OB even, and you're the primary surgeon at that time. And so, but with like more like support, with the attending physician as well.
Because I'm interested in public health, I know that Kaiser leads the way in making a lot of these guidelines that the rest of the nation follows in terms of screening protocols and preventative care.
After the access to abortion became heavily restricted around the country in 2022, those of us in California really felt the need to do something. And one of the things that we can do for our colleagues around the country and patients around the country is to help train residents, because 40% of OBGYN residents are training in places where there's no access to abortion anymore.
We have this long-standing relationship with UCSF, and this program has really allowed us to create an environment of undergraduate medical education and graduate medical education. So we really mimic a medical school in this small clinical environment.
For prospective applicants, honestly, just the people are incredible here, and it makes coming to work each and every day so much fun.
I think that is a huge relief to be able to really focus on learning and focus on my surgical skills and know that there's a lot of good support for my patients.
We have the opportunity to become the best doctors that we can be because we're working in such a positive environment.
And people feel really comfortable being themselves and talking to the faculty. We have a lot of mentorship, both informal and formal.
At Kaiser San Francisco, we're looking for people who would love to join us, who are excited to be part of our community, who have a love and joy for taking care of people, and great clinical training opportunities that rivals any program in the country.